Hello and welcome to Real Health with me, Carl Henry. This week is an episode we've wanted to do on the podcast for a long time. There's so much fear around cancer, I don't need to tell you that. But taking the fear out of it and getting the crucial information out there is something I really feel is important and I'm really passionate about. To help me do this, I'm delighted to be joined by Bernie Carter, Assistant Director of Nursing Services at Marie Keating Foundation. Bernie, welcome to the show.
Thank you so much. Delighted to be here.
This is a really important topic, isn't it?
Yeah.
There is a lot of fear out there about cancer, and it's really important to chat about it, to dispel the myths and have a really good conversation, giving people all they need to know.
Absolutely. I think I'm 35 years in this area as a cancer nurse, being around the globe. We've come an awful long way. And really, you know, cancer, it's not what it used to be. We're getting better thanks to newer treatments, thanks to informational sessions like this today, thanks to research, etc. And I know today we're primarily going to talk about breast cancer. And as a breast cancer nurse specialist, somebody who had breast cancer at the age of 26, we have definitely come a long way, and I'm here today to say that. So breast cancer, it is the most common cancer in women after non-melanoma cancer, non-melanoma skin cancer, but it is the most common cancer as well that women are surviving. So over 3,000 women, about 3,400 gets breast cancer in Ireland every year. Oh. Roughly about 750 women do die from breast cancer. And I think what's really important there then, more people are surviving breast cancer, but especially if we catch it in time.
Early detection.
And that's crucial.
Yep.
Yeah, that old stitch in time saves 9.
And do men get breast cancer?
Great question. Yes, men do. Roughly about 29 men in Ireland gets breast cancer every year and about 6 men die from breast cancer. When it comes to men, and we'll talk about risk factors for men and women, men can also be carriers of a gene called the breast cancer gene. We call it BRCA, so BRCA, breast cancer gene. We all have it, BRCA1 and BRCA2. There's 2 of them. Okay. They're there to protect us from cancer. But these genes can become faulty. And now instead of protecting us from cancer, they can increase our risk of breast cancer, ovarian cancer. For men, especially with the faulty BRCA2, they can also get breast cancer, but they can be at risk of prostate cancer, and then to a lesser degree, pancreatic and melanoma. So if a man or a woman, a mother or a father, are carriers of a faulty BRCA1 or BRCA2 gene, there's a 50% chance at least that one of their children or one of their siblings can have a faulty BRCA1 or BRCA2 gene.
And can you test for that gene?
Great question, because this leads us into risk factors. I manage the BRCA services in the Marie Keating Foundation. We have loads of services for men and women with the faulty BRCA1 or BRCA2 gene. You have to be referred by your GP, and you can be referred publicly or privately. Publicly, there's about a 1-year wait list. Privately, a lot faster, 2-tier system. Generally, it's a blood test, but now they're also doing salivary tests.
Oh, wow.
You can be outsourced to an international body, and there's a few different companies that also will send a saliva test in the post. But in Marie Keating Foundation, we're more recommending that you do it in Ireland, where you get genetic counselling, psychological counselling, because it is hugely important. And I think, Carl, that would lead us nicely into talking about risk factors for breast cancer. Great. Because let's talk about BRCA. So then we'll talk about the risks we can control and the risks we can't control.
So with anything, there are controllable risks and uncontrollable risks.
Yeah.
So let's start with the uncontrollable.
Exactly. So the uncontrollable would be getting older. So breast cancer is more common as women go into the menopause, so it's more common over the age of 50. But we just talked about that faulty BRCA gene. If a woman we'll talk about here, if a person born female, we should say, is born with the faulty BRCA1 or BRCA2 gene, their risk goes up from what would be in the general public about 11% risk of breast cancer. With a faulty BRCA1, it can go up to 70 to 80 to even higher percent getting breast cancer. With a faulty BRCA2, a little bit lower, more like 69 to 70%. But it very much depends on where the fault is on the BRCA gene and the family history. Family history is another risk factor, even without those faulty genes. Faulty genes would account for about 10% on average. But I wouldn't think that in all the women I have in my services, but roughly about 10%.
So, and if you had a parent who, either male or female, who had breast cancer, you're more prevalent, presumably, to
Exactly.
develop it. Yes.
And that's the other risk, even without that faulty gene. But if you have a mother, a sister, a daughter who've had breast cancer, I would be recommending getting referred for genetic testing, especially if the breast cancer occurred under the age of 50. And also, breast and prostate are linked. If there's breast and prostate cancer in one side of the family, before the age of 50, there could be a faulty BRCA gene. So again, it's not just breast, and people don't actually realise about the link. So
and should you go for testing at any age? So say if your mother or father had either breast or prostate cancer, or a sibling, should you then go at any age?
Over the age of 18.
18.
And generally they say by 25, because the risk starts to go up from 30. And it depends when and what age the family member got breast cancer. Okay. So say, for example, the mother got breast cancer at 30, then your risk is that and even less as a sibling or a daughter of the mother. So really, we would recommend, if a person has been diagnosed with a faulty BRCA gene, that they talk to their GP. GP has a referral system where they refer into clinical genetics in Crumlin or St. James's Hospital, which are the two places that are publicly testing in Ireland. Privately, you're looking at the Mater, the Hermitage, Blackrock Clinic, and that way then you are referred into the system, and there's a whole family questionnaire.
And do they come up as part of corporate screenings as well? Is that something that
sometimes
they may,
they do.
if they go into the family history, they may...
Yeah. But again, we want to protect the individual. So I'd want to know in a corporate screening, is genetic counselling offered? Mm-hmm. Is psychological counselling offered before and after? So let's talk about the other risk, because, okay, genetics, 10%. Family history without even genetics increases your risk. And some risks, as I say, we can't control. Having children later in life or having no children at all, later in life is after the age of 30. Still very young.
Very young.
Yeah.
Yes, as a 41-year-old.
Exactly.
Very young.
As a woman, starting your period before the age of 10 or going into the menopause after the age of 55, the body is exposed to our female hormone estrogen for a longer period of time. And the majority of breast cancers are estrogen positive because there's so many different types of breast cancer. We can't control that, okay? Having dense breasts, and dense breasts we'd see mostly in women who haven't gone into the menopause, but it can continue, where the breasts may be more fibrous and less fatty. That can increase your risk, but we can't control that either. Firmer breasts, but you can't judge it by the naked eye. It would more have to be picked up maybe by an MRI, not as much maybe by a mammogram. So it's not, and it's something we're learning more about as well. There's more research. But things we can control.
Yes.
So obesity is a big one. And especially as women go into the menopause. Because as women go into the menopause and their hormones are lowering or dropping, or then the drop in estrogen can cause an increase of weight around the waistline. And where we have got an increase in fat around the waistline, the fat can produce estrogen. And that can increase the woman's risk of estrogen-positive breast cancer. Inactivity. We all need to be more active. And we know that inactivity can increase the risk of many cancers, but breast cancer as well. Alcohol is a huge one when it comes to breast cancer. Wow. It is the most common cancer caused or linked to alcohol. Wow. Just one glass of wine, which is 100 mils of wine. It's not a
very
big,
small glass.
Exactly, and it depends on the percentage of alcohol as well in that wine. So one glass of wine per day increases a woman's risk by up to 9% of getting breast cancer. Roughly 1 in 8 breast cancers in Ireland are linked to alcohol. Less is best, none is better again. But if we can even do less is best. Smoking as well is another one. And then I will be shot for this one, but hormone replacement therapy, a godsend for women. Contraception, a godsend for women as well. Yep. But with hormone replacement therapy, it's got safer, it's got better. We will not even mention where it came from long ago, because it's actually quite amazing. If I did tell you, if you want to know, I'll tell you.
Go for it, why not?
Pregnant mare's urine.
Oh, I've come across this.
That was long ago, not today.
We've come a long way from there.
We've come a long way. It's more similar to our natural hormones. But combined HRT, where you've got estrogen and progesterone, think of it as double the trouble, there may be a slight increased risk of breast cancer. So chat to your GP.
But again, of all the manageable things we're chatting about, that's lower down the pecking order.
It's lower, but it may be there, especially
food,
if
alcohol, smoking,
those things,
obesity.
Those are the big
Activity,
guys.
yeah.
Exactly. So it is lower. So the ones, the HRT and the contraception, maybe there, but still like the risk is lower. Chat to your doctor. Will we talk about what to look out for, how to check yourself?
You're amazing. You're interviewing yourself. I love it. You're making my job very, very easy.
I'm passionate
over here.
about
You are,
this. I'm many years doing this. So, yeah.
Let's just recap for a minute, though,
Yeah.
because we've covered a
Let's
lot of
do,
ground in
yeah.
a very short space.
Yeah.
Key thing we're saying is that men and women can get it.
Absolutely.
That's important. Early intervention is
Absolutely.
important. Family
Yeah.
history is really important to look at.
Yeah.
And that
Yeah.
if you have a family history, go to your GP and go through that system.
Yeah.
What we can control, what we can't control.
Lovely.
We've looked at all of those.
Yeah.
And we're basically saying, like a lot of other things, moderation when it comes to health.
Exactly.
The alcohol thing is, if you tell people never to drink again, they'll switch off.
I know
so
that.
sense of
Yeah.
moderation every now and again is,
Moderation.
Yeah.
If we're 80-20, good. If we're doing, I think,
Love it.
and go to mariekeating.ie website. Loads of information, including a video to check your breast, show you how to check your breast. And what we want to do is take the fear out of cancer.
Bring people through that then, because I was going to go down that in terms of
checking your breast.
Yes.
So it's looking and feeling.
Yeah.
So you want to look for changes and you're going to feel for changes.
Yeah.
But number one, know what's normal for you. We're all very different. Some are born with maybe one breast larger than the other, maybe one a little bit lower than the other. Know what's normal for you. If you're still having a period, you want to check about 5 to 7 days after the period.
Yeah, okay.
Because before or during the period, the breast can be quite lumpy and quite sensitive.
I was just you're ahead of me.
If you're in the menopause, check on your birthday. Check that date every month, as long as you're not like leap year and the end of February. But choose a date every month. Do not be afraid. It just takes 5 minutes. So I would recommend, as a mother of 4, not doing it in the bathroom if you have a lot of children and someone banging on the door. You want to be relaxed. Turn on the music, light a candle, put the key on the door, get some moisturiser. If you do plan to do it in the shower or in the bath, use some moisturising cream on your breast. So the first thing I would say is look for changes. Stand in front of the mirror, hands on the waistline, no clothes from the waist up. Know what's normal for you, and you're looking for any change. Does one breast look lower than the other? Does one breast look larger than the other? Can you see any areas of redness? Is there any what we would call orange peel that looks like the peel of an orange?
Okay.
Is there dimpling? Is there redness? Not every breast cancer is a lump. There is a type of inflammatory.
So change in pigment in terms
change
of
in
the skin,
pigment,
yeah.
inflammation, change on the nipple. Marie Keating herself died from a type of breast cancer that's very curable and more curable than preventable, which is breast cancer of the nipple, Paget's disease. Is the nipple changing direction? Some women are born with the nipple inverted. Is it now changing direction? Is it starting to invert when it wasn't? Is there a rash around the nipple? So you're looking as well to see, do the veins on the breast stand out more than usual? So firstly, hands on the waist, then hands over the head and lean forward.
You've already scared half our listenership.
I don't want to scare anyone.
Not with the content, actually, but
Yeah.
purely because I think Irish people struggle with that idea of standing in front of a mirror naked. I think there's a self-love piece that we have
Yeah.
to we're behind maybe Europe from that regard. That just standing in front of the mirror for people with their clothes off, it's a very challenging.
Well, it is very
challenging thing to do,
Yeah, but it's very important.
Oh, it's crucial, absolutely.
Because
Yeah, it is.
most common cancer for women is
Yep.
breast. The 5-year survival rate from breast cancer has gone from roughly 40 to 50% when I set out and specialised in breast cancer for 10 years in Vancouver to now 88 to 100
Yep.
if we catch it in
So
time.
the key thing is a little bit of self-love.
Exactly.
Put on some music, put on a
Embrace your own
candle,
body.
go for it.
Yeah.
And
Go
however
for
you
it.
look in the mirror, you look in the mirror.
Exactly. And any checking is better than no checking. And again, look at the video on our website as well. Get rid of that fear. So look for changes. Look under the armpit as well. And when we're going to check the breast extends from the breast itself, including the nipple, up to the collarbone and into the armpit. So in feeling for changes, so you look and you feel, one hand over the head, you can lie on the bed, you can do it in the shower, just use a moisturiser of some sort because it can make the skin can be quite sore if you're rubbing on the skin. You want to cover the entire breast. So I would suggest starting on the nipple, using the paddings off the top of the fingers, press gently, do a little circle, do not lift the hand. Slip along. And you can move in a clockwise or an anti-clockwise and cover the entire breast up to your collarbone, slip into the armpit, or you can press a little bit harder. Do not panic. If you find something, 9 out of 10 changes are normal. If it's that 1 out of 10 changes and we ignore it, so if you find something, don't panic. That's number 1, okay? We also recommend squeezing the nipple and checking for any discharge. If you're after having a baby, most likely it's going to be discharge. But we still, especially if it's just in one breast and not in the other, if it's bloody or if it's new for you, please get it checked out, but don't panic. Could be an infection. It could be anything else. So again, look for changes, feel for changes. It's all on our video on our website, mariekeating.ie. And we have wonderful new GP referral guidelines since 2021 in Ireland. Please pop off to your GP. Don't feel like you're wasting your time. Unfortunately, during COVID, we had less cancers diagnosed because we were afraid of getting COVID. We were told not to go to the GP or the hospital. And unfortunately, we're seeing more later stage cancers in the Marie Keating Foundation. We need to get back on track. So please do go to your GP. And the GP will reassure you, because you may think, well, I don't know what I'm feeling here. The GP can do a self-check. If the GP feels something, the GP is concerned at all or sees something, because again, not every change is a lump, we have new fast-track GP referral guidelines where you can be referred into your local main hospital. We have 8 centres of excellence. There's actually 9 hospitals participating in breast specialty. So you'd be referred into a breast specialist. And in there, they would do what's called the triple assessment. Okay. You'd have an expert feel and check your breast. Then the second part would be maybe an MRI, depending on your age, because mostly mammograms are for women beyond the age of 40. And so maybe an MRI and a mammogram, maybe an ultrasound. And the third check is to definitely find out what's going on here. If a lump is found or a change is found, would be a biopsy or a liquid aspiration. And that's sent off to the lab to see what's going on here. But please, really, I would say, take a deep breath if you find something. It may be here today and gone tomorrow, so check again tomorrow. But to be sure, please go and get checked out. 9 out of 10 changes again are normal.
That regular routine, regular checking, pick the same day each month.
Know your body.
And know your body. And also have a chat with your partner.
Absolutely.
Around this conversation as well and those symptoms. So look for those symptoms.
Get your partner to check.
Yeah.
You know, often we don't know what we're feeling. And I must say, like, I've done that myself. I get my partner to check because some people are lumpy breasts. Some people have lumpy breasts even after the period or during the menopause, and you don't know what you're feeling. And pain, breast pain, a lot of people would worry about that too. Most breast pain, we get breast pain for lots of reasons. But if it's there and it's continuous and it's bothering you and it's been there, we would say for more than 3 weeks, just pop off. Just go get checked out.
Bring us on the journey then. If that test comes back positive.
Yeah.
Then what's the journey for people from there in terms of, presumably it depends obviously on the type of breast cancer, I would imagine.
Good thing there, Carl, because one thing I'd say, never compare your breast cancer journey to somebody else's. Like all cancers, there's so many different types of breast cancer. Some, and the majority, up to 80%, are what we call hormone positive ductal, so in the ducts where it carry the milk in the breast. So that would be the most common. There could be hormone negative, where the hormones are not making the breast. There could be breast cancer of the nipple. There could be inflammatory. And also the treatment would depend on you as well as a person. What do you want? What underlying conditions do you have? So I'd be very careful about comparing journeys. Yep. But now, thankfully, we've got a wonderful system in Ireland that if someone is diagnosed with any cancer, you have a multidisciplinary team of experts. You'll have in there, you'll have the person who did the biopsy, the pathologist. You'll have the oncologist, who's the person who if need be, will give chemotherapy or other treatments, because we have more than chemotherapy nowadays. You will also have maybe the radiation specialist who would deliver radiation. You have the breast specialist nurse. You may have the surgeon. So it's more, also surgery now is more conservative than when I started off. If a lump is found and the lump, or if the non-lump is found to be cancer, then it will be staged, S for size, S for spread. Has the cancer spread? So that would tell us that it is beyond what we would call a stage 3. All cancers are staged between 1 and 4. Breast cancer tends to be staged between 0 and 4. 0, the cancer is what we call, it's in situ. It hasn't moved out. It may be a pre-cancer. Then a stage 1 means it's very small. It's less than 2 centimetres. A stage 2 and 3 means that it's starting to go to the local nodes. And then and these are all curable. 0 to 3 are curable. Early stage breast cancers. Once it has gone to a stage 4, it is now controllable and not curable because it has gone to another organ in the body. Okay? But we're doing much better as well with stage 4s nowadays as well. Of course, ideally, the best treatment for any cancer is prevention. Yep. The next is early detection. Often cancer passes us out and we're doing all the right things and it has spread. But I will say as a breast cancer nurse, and we have, and the Marie Keating, several support groups for people going through cancer of any type.
I was going to say that. So there is, there's a huge level of support out there.
Yeah. In Marie Keating, we have the Positive Living support group, free support groups. Positive Living is for people who are living with cancer which has spread. The other word for that is metastasized, or it might be called secondary or advanced. People are living longer, newer treatments. I would have been the first immunotherapy nurse in Ireland. So it's not just chemotherapy anymore. We'll talk about treatments shortly. We also have the Survive and Thrive support group, which is for people who have survived cancer and breast cancer of any type, coming out the other side and want to go back to life after cancer. And I manage, and I'm passionate about our BRCA services. I have peer-to-peers, 10 ladies with BRCA1 or BRCA2 fault. We don't say mutation anymore, we say alteration. And they are there to support others on a voluntary basis. I have my online support groups. I have a BRCA conference last Friday in April every year. Lots there to support you, okay? So we're coming again, we'll go back and keep on track. Like you say, what happened? What happens when a person is diagnosed? So the team comes together. They look at the size and the spread, the stage. They look at the cell type. That's called the grade. And it can get very confusing. But they're really analysing the actual cancer, the individual, the underlying condition, and the team comes together. Be reassured it's not one person deciding your treatment, and you, the individual, to be in there. As a cancer specialist nurse for more than 35 years, don't go it alone. Go in with somebody. If you haven't a family member, bring a loved one, bring a friend. Because I think even now when people hear cancer, they forget everything else.
They do, of course.
Bring someone with a notebook and a piece of paper. Ask, can the meeting be recorded? You're within your rights to do that, because you will not hear even the next appointment or what the treatment. Again, treatments have got better and better. If it's early stage, it means less treatments in general. And not everybody gets chemotherapy. And people worry about side effects. Early stage might be just conservative surgery, removal of a lump, as opposed to in the entire breast. If you're found to have a BRCA1 or BRCA2 gene, risk-reducing surgeries mean that having both breasts removed greatly, up to 95%, reduce your risk of breast cancer. Huge road to go down, and we could do another one in BRCA, one whole one in BRCA. So if it has even gone into the nodes, most likely you will need more than that surgery. You may need radiation. The radiation may be first and then the surgery. Again, different for everybody. So you'll need multiple treatments if it has gone beyond the cancer itself and gone into a node, and if it has gone further. So, it could be a combination of radiation, surgery, chemotherapy, and the newer treatments. If it is hormone positive and is growing with your female hormone, then you may be on hormone treatment for several years. That doesn't mean the cancer is spread. It means we need to stop these hormones from causing the cancer to come back or causing the cancer to grow. And the option is there to have reconstruction if you have to have the breast removed or if you're having both breasts removed. In October every year, the Marie Keating Foundation, myself included, we run what's called a BRA Day, Breast Reconstruction Awareness Day. So we have experts come in and talk about having breasts removed. Yep. And we have women come in who are so amazing, who've had reconstruction, pop on a dressing gown, go into a private space and show others the reconstruction. So there is a road.
The thing is that it's very individual for people.
Very individual.
But time and time again over the course of the interview, we've come back to very similar things, which is early detection, early prevention, early. Control your controllables in terms of lifestyle, in terms of food, in terms of alcohol, in terms of movement and activity levels. And if you have a family history, do go get it checked. Remind me of the website again for people if they want to go there.
One last thing they should do as well, if you're between the ages of 50 to 69, make sure you're registered for Breast Check, our national screening programme. Okay? So mariekeating.ie 016283726. info@mariekeating.ie. We have what's called an Ask the Nurse service. If you would like to chat to somebody, you're unsure, please do phone or email us. Go onto our website. Loads of supports there available. Also this month, and I think we're very proud of this, we're doing the 100K in 30 days for breast cancer. Get active. Exercise is great even if you're going through a cancer journey, but talk to your doctor. Help with side effects, help with treatment, help psychologically. I wish we could put it into a tablet.
Absolutely. Yeah. Bernie, one thing they should do is get a podcast going and put you at the helm of that podcast, because you basically self-presented for the last 25 minutes, note-free. You're absolutely amazing. Thank you so much for coming in.
Thank you so much. Delighted.
Folks, that is it for another episode of Real Health with me, Carl Henry. I really hope you enjoyed that episode. Do check the website out if you need to. You know where we are, at Carl Henry PT on Instagram, realhealth@independent.ie, and we're back next week for more Real Health. Slán go fóill.